Good morning, everyone. Before I start, I want to give a trigger warning. The content presented in this video contains information about sexual and physical violence that can be triggering for some listeners. My name is Mustafa Naseem, and I'm a clinical assistant professor at the University of Michigan School of Information. This study was done in collaboration with Fouzia Younas at the Information Technology University and Dr. Maryam Mustafa, who is an assistant professor at the Computer Science Department at LUMS in Lahore, Pakistan. Studies show a direct positive impact on mental health resulting from the ability to openly express unpleasant feelings, or otherwise known as distress disclosures. Studies also show that the opposite is also true, that the inability to express and share negative emotions and trauma leads to many psychological and physical disorders. In a country like Pakistan, where women only have a few safe spaces to share traumatic experiences of abuse, where the literacy rate among women is only 47%, and where existing social media platforms have failed to provide low literate women an opportunity to share their narratives in a safe environment, our work provides insights and a design framework to navigate and design around these challenges. Our study comprises of two distinct phases. In phase 1, we conducted 21 semi-structured interviews with a focus on support-seeking behavior of women in patriarchal contexts who have experienced mental health issues. Based on our findings, we identified design implications that could provide support to these women. We used these findings from phase 1 to conduct a qualitative research activity using a technology probe with 15 low-income, low-literate women participants. The goal of these activities was to understand the possibility behind a voice-based peer support system. We present insights around user registration, anonymity, privacy, and security. In phase 1, from our sample, 71% of the participants reported experiencing depression, 43% reported experiencing domestic violence, and 29% reported being subjected to sexual harassment. Our participants expressed fear of talking about mental health concerns and seeking help due to the negative societal perception around mental health. 12 participants complained about their husbands not taking on financial responsibility for the family, where drug addiction was reported as the main concern for their husband's apathy. Leaving such a marriage wasn't a realistic option for our participants, as divorce is stigmatized in these circles. We found that while our participants relied on existing social networks like siblings and friends for non-taboo topics, they felt reluctant to share taboo topics such as female sexuality or sexual harassment. Our findings revealed a need for an anonymous, non-judgmental, safe space to allow women to share their narratives and find support. In study 2, we used a technology probe with various registration options, authentication options, and a voice filter to anonymize audio content. In terms of registration, 9 out of the 15 participants said that they would feel comfortable talking to a real person in order to verify their identity. As far as authentication and user safety is concerned, we found a distinct divide between smartphone and feature phone users. All 5 smartphone users used a lock on the home screen. 3 users used a pattern lock, while the other 2 used PIN codes. However, none of the 10 feature phone users had a password to unlock their phone. One of our participants even mentioned that her husband kept an eye on her call logs. In the paper, we go into a detailed discussion about the need for a password and how to go about implementing one. With the voice-based service, it becomes harder to hide the identity of a user. We tested various voice filters as part of our technology probe. 11 out of the 15 participants agreed they found the voice modification feature to anonymize their voice useful. However, the most interesting responses came from women who declined to use this feature. We found that while voice filters are a viable option, they are not always preferred by the users, as they detract from the seriousness of the narrative and strip it of its emotional valence. In terms of recommendations, we recommend that when designing for women in patriarchal contexts, a framework of connectedness would be useful, where applications for women within this context should include backdoor features that allow women to be able to connect with each other. For user safety, we recommend a 2-pin system, where the first pin leads to the actual application and the second pin leads to an innocuous application such as weather or news. For anonymity, we recommend limiting the availability of the post from the city of the poster to reduce the chances of the identity of the user being discovered from the story itself. Thank you for your time. If you haven't had a chance, I encourage you to read the paper and feel free to reach out if you have any questions.